So flu vaccination is really helpful, particularly for people who are at risk of the complications of flu. So we often think of flu being maybe as just a bad cold or something like that, but there are certain groups of people that are at quite high risk of hospitalization and severe complications like chest infections and things like that. So hospitalizations are tracking at an average rate at the moment for influenza. There has been a higher than average number of notifications so far this year. So there are sort of by age group, we've got the young kids and babies. So those children aged less than 5, that sort of preschool group, and the toddlers. And the infants, they do have a higher risk of hospitalization from influenza, and actually about 50% of the hospitalizations due to influenza are children. Then we have the older adults, so those over 65, we know that they have a higher risk of complications of flu and hospitalization. And then we have adults and older children who have medical conditions which might put them at risk of complications of flu. Yeah, so the other group that are more vulnerable to complications of flu are Aboriginal and Torres Strait Islander people. We know that they do have a higher rate of hospitalisation and complications from flu, and so it's particularly important for Aboriginal and Torres Strait Islander people to get vaccinated as well. Flu shots are available very widely, particularly from general practice. The vast majority of general practices will have a good stock of flu vaccines coming in from the government, and they will often make arrangements for their patients to book into often special clinics, flu clinics,